I've been in oral surgery now for 29 years. I practiced for 5 years before I started with BayCare Clinic, and I've been with BayCare Clinic now 24 years.
My very first job was working in an oral maxillofacial surgery clinic, and my father was one of the surgeons. That was what sparked my main passion and interest in pursuing dentistry to begin with.
My name is Brandon Newell. I'm an oral surgeon with BayCare Clinic. I grew up in Spirit Lake, Iowa, which is the northwest part of Iowa. I went to dental school at Iowa. I went to University of Minnesota for my residency, and I've been working in Northeast Wisconsin for almost a decade.
I went to Marquette University School of Dentistry where I obtained my DDS, and then after that I moved on to Kentucky where I finished medical school. I did a year of general surgery internship and finished up with my oral and maxillofacial surgery residency.
My name is Tyler Smith. I grew up in Little Rock, Arkansas. Went to the University of Arkansas for college where I earned my Bachelor's of Science in Biology. Then moved to Memphis, Tennessee to earn my DDS degree, University of Tennessee, and moved back to Little Rock where I was a general dentist for 4 years, at which point I decided that I should go back to school and become an oral and maxillofacial surgeon.
Our vision is to be nationally recognized as the destination of excellence in healthcare by our patients and our peers.
In order to provide a high degree of comprehensive care for our patients, collaborating with the patient's dentist and physician is a very important aspect of our treatment.
Almost every patient takes some level of collaboration. The first person to collaborate with is the patient themselves to make sure that they're on board with expectations, with what we can offer them.
One of the things that BayCare does well is we're leaders in the community.
We do a lot of complex treatments and complex procedures, none of which would be successful if we're not listening to the patient needs and the patient concerns. We need to collaborate with the patient's physician, with the patient's doctor, with the patient's dentist. This also allows us to not only achieve the appropriate treatment plan, but it also allows us a roadmap on how we're going to achieve those goals.
Staying current in the most up-to-date technology and literature in oral and maxillofacial surgery is a day-to-day process. From reading new journal articles every month to going to continuing education courses around the country to learn new techniques, to a phone call with a collaborating doctor or oral surgeon. Every day there's an opportunity to learn something new to stay current in our field.
Being an in-network provider for patients is not only beneficial for the patient who is paying yearly for insurance and to be able to afford the care that we give, being able to have a patient have a smile that they're happy with, relief in a procedure that they needed, and to be able to have it covered by something that they've been banking on to have insured for is the reason why we are in-network for most of these insurances.
Early in my career, the most rewarding part of my practice was doing orthodontic surgery where I could change someone's face and make them feel good about themselves. As I've gotten older, I've done less of those surgeries and more dental alveolar care, which is wisdom teeth and implants. And I really enjoy restoring people's bite and their function and their looks with implants today.
We try to get involved with several groups in the community, providing continuing education for different outlets of dental providers in this area. So that's one thing that we pride ourselves in doing at BayCare. Our service line really prides ourselves in being able to support the community in Northeast Wisconsin. We have multiple locations. It is a rural area.
Becoming board certified by the American Board of Oral and Maxillofacial Surgery is the gold standard for practicing oral and maxillofacial surgery throughout the country.
There's been a lot of changes over the years that I've been part of in the oral and maxillofacial world, and I think at BayCare Clinic we've been at the top of that as far as technology and learning and giving the best type of care that we can.